I'm very pleased to introduce the President and the Chief Executive Officer of Union Hospital and Union Health, Steve Holman. Joining him today will be our Chief Medical Officer at Union Hospital and Union Health, Rebecca Lynch. They will each deliver a short prepared statement, and then they will both take questions following the statements.
Hi, I'm Steve Holman, President and CEO of Union Health, and I am just delighted to stand before you to tell you that today we announce two strong teams, two medical teams in this community coming together. Terre Haute Regional Hospital and Union Health joining forces and signing an agreement that I think will be a milestone for this community. This community, as far as the projection going forward for health, you probably are aware we're in a lower quarter to third of all the metrics that are out there for health, and we believe coming together we are stronger to improve the health and wellness of this community like the Wabash Valley has never seen before, by improving access to care, by the specialty services, by the recruitment, a whole host of things that we can be stronger. We saw during the pandemic that if we could have worked even more closely together, we'd even done better at serving this community. And both institutions worked as hard as they could, but there were silos there. And we break down those silos, we come together, we'll be a much stronger team. As many of you know, we have a community plan that the Chamber has helped organize, and I've been co-chair with the mayor on that. And that community plan is transforming the Wabash Valley, and part of that community plan is health and wellness. There's nothing more that'll help change the trajectory of the health of our community, lowering cost, improving quality, than these two teams coming together, two really respected teams in this community, and we are so excited about it. With that, I'm going to turn it over to Rebecca Lynch, our Chief Medical Officer, for some short comments.
Hi everyone. I'm just so excited to be here today and be part of this announcement. For physicians, I think this is going to give us a great opportunity to increase our collaboration, work together in a different way. We also are going to be able to increase our access to care, bring more specialties in, like Steve said, hopefully recruit more physicians and more providers to the community. As a member of this community for the majority of my life, I'm just thrilled that we have this opportunity and we can really unite forces. I think that the strength of both teams is going to be much stronger than just one team alone. And I have had the joy and privilege to get to know many of the team members at both institutions, and just phenomenal people. We're talking some of the best staff, physicians, and patients that, I would say I'm just proud to be able to be part of this, moving forward. And hopefully we can take that lower third mark where we stand in healthcare today and really drive that upwards and be in the top third. So thank you so much.
I do want to add, I could have mentioned before, that although we signed yesterday a definitive agreement with HCA, who own Terre Haute Regional Hospital, it doesn't actually close until early in 2024. We don't know the exact date of that. We have to go through several things with that. So everything will remain the same till then, and both hospitals will be fully functioning. With that, we'll open it to questions for Rebecca or myself.
Can you say what this means for regional employees, and will any of them lose their jobs or be laid off?
Yeah, so the question is, what does it mean for all of our coworkers? And they have coworkers 662 strong, and every one of them is going to have a position at the same or comparable pay. And so we're so excited about that. I've been down there all day today talking to the regional associates and coworkers that we have, and just welcoming them into the system that we're creating for healthcare. So yes, every one of them will have a position in this kind of robust healthcare system that we are creating.
But it may not be what they've done before.
So I think there'll be a variety of ways that they'll do that. I think a lot of them will be a direct match. We need to go through that for these coming months to figure that out. We just signed yesterday, but many of them will be working in the areas that they do, and we're excited about that.
And on that same topic, my understanding from maybe some regional employees, there were town hall meetings today. Kind of what was the feel there and what was the message they went out with?
Yeah, so I participated in the town hall meetings and we had really good attendance. I think there is, first of all, a little bit of, okay, what is this and what does this mean? And so they had really good questions along that about what that looks like. But I think there's a sense of excitement that we could grow healthcare services and offer more services perhaps than it's been in the past. And I saw that from several of our coworkers there, or future coworkers that are there. I really appreciated that. There's a dedicated team has provided care. As you know, St. Anthony's, which was the original Terre Haute Regional Hospital, was the first hospital here in the Wabash Valley. So we've got a lot to build on there. And I think there's some excitement there too. I'm sure also some, okay, what does that mean for my pay and benefits and everything? And we're going to have a series of meetings over the coming weeks to help them with that.
Can you say how much, the dollar amount of the acquisition?
We are purchasing all of the assets, both inpatient and outpatient, and ancillary services there. The actual dollar amount is not public information.
I talked to some residents on the streets today. You know, some people were excited thinking, you know, they can share resources. You know, a few people were concerned that, you know, now there's not competition here to shop around. So what's your thoughts on that and the community? Yeah,
so what I would say to the community is this is the opportunity to offer more robust services than we've ever had in the history of the Wabash Valley. So as we build and as we get the recruitment that you heard Dr. Lynch talk about, it's going to provide more choice for more physicians for them. Yes, to do that, we need to come together, but in and of itself, I would tell you, we've always had pricing that's slightly less than the Indiana average here, and I do not anticipate that changing from the competitive point that you talk about.
And you know, this was kind of part of legislation at one point, and you spoke up there at the State House about making this possible for especially rural communities. Can you kind of touch on that? Sure.
So we appreciate the state of Indiana and the legislative approval. We said we'd like to be the poster child for the state of Indiana to improving health metrics. And the legislators listened. They said, how can we help you? And they came and they did. And they've provided a process for us to be able to do that. That's what part of it makes this so exciting. So we'll be really working close with the state of Indiana, the health department, was Dr. Christina Box. Now it's Dr. Lindsay Weaver. She was in the community last week. We delivered that message that we'd like to be the poster child. And I think we're going to have a lot of resources come about to help us make this work. Really excited about it.
Will both hospitals kind of run as independent hospitals, or will that just be, you know, specialty things?
Yeah, so first of all, until we close, sometime in early 2024, everything's exactly the same. We will be asking the clinical teams to get together in all the areas that we offer care in, the physicians, the clinicians, the support staff, to help us answer the questions of what is that robust care look like, and where are the appropriate places for that. So they'll all be involved in it. That has not occurred yet, but certainly will over the coming year.
Do you anticipate maintaining what is now the regional hospital facility as a hospital? Or
absolutely. Okay. Full-fledged. It is a hospital. It would continue to be a hospital. Yes, it will.
Do you anticipate a name change at some point, maybe?
Yeah, so we had a lot of questions today from the associates, and we are getting their input. We like community input on that, and we're very open to that, but you know, what best resonates and what would best designate both places. And so one of them even said, why don't you have a little contest with names ideas? I think we're going to do that. So that has not been decided yet.
And so the next part of the process, you know, I'm not sure if, you know, has a COPA, have you had to apply for that, or what's the next step?
Yeah, so we have some regulatory approvals that we need to go through, and those are, as we speak, this week are being submitted. We have things just to do like you would close on your house. We have things with financing to figure out over these coming weeks. And also onboard all the 662 co-workers that are there. And so that will take some time to do, and that's what goes into 2024.
So I think those 662 workers, will they be considered union employees and eligible for all the benefits that
yeah, definitely. All the seniority comes over, everyone's offered a position, and by the way, this is all local. Where currently HCA is owned by an out-of-state firm. All those jobs and everything like that will be here in the Wabash Valley or thereabout in the state of Indiana. So we're kind of excited about that too from an economic perspective. But yes, all the benefits and all that and such comes over with seniority, just like they were here all along.
The steps that remain, you know, the regulatory, is that state, federal, or both?
It's a state, the regulatory process is a state that has to do with the COPA that you mentioned.
Okay.
Yeah, and that will be submitted, yep.
But there's no question that will go through. I mean, is there?
I believe we'll have support on that, but we do have to apply for that and meet all the regulatory guidelines for it and everything, which I believe we will,
And
for the benefit of this community.
Dr. Lynch, you mentioned specifically, you know, as far as retaining people and hopefully bringing in more physicians.
Absolutely.
So can you kind of speak a little bit on that?
Yes, absolutely. So I think that over the past few years in particular, we've really strived to grow our service lines. We've also seen some changes in healthcare and shifts in how healthcare is delivered. And we really want to be at the forefront of that. We want to be innovative. We want to deliver the highest quality care. And I think together we'll be able to do that, and we'll have a broader group of physicians, staff, and providers to be able to do that. And also with a broader group, sometimes you can recruit easier. And I think this will be, you know, this is an exciting time. We're really moving in a very forward direction. And I think that will be a, you know, this is a good place to be to recruit good talent. So I'm very excited about that. And then ultimately, once we have recruited additional providers, we can deliver even more care to more patients. And that's really what it's all about, is making sure that we have the care that everyone needs right here. You don't have to travel for that care.
Are there any areas you hope to really focus on that maybe you can't do what you want to do that you hope to do more?
Absolutely. I would say the healthcare shortage is nationwide. This is not something that here in the Wabash Valley we're experiencing alone. We see deficits across the nation with primary care, GI care, urology care, surgical care of all sorts. And so we would like to recruit and make sure that we are well staffed in all of those areas, and even those that I haven't mentioned. But this is something that is very important to us, and to be able to have all of those basic needs, and then as well as the specialty needs here in the community.
And I don't know if this is something you can touch on or not, but as part of that legislation and being able to make this possible, was there something along the lines that, you know, one of the hospitals had to like maybe have a residency program or be a trauma center? Was there kind of some stipulations?
So that's a very good question. What I will say is, so we do have a very active family practice program. I always tell the residents, because I get to meet them every year, I get to come and meet them, and we have multiple touch points through the year. But they're really the heart of, I'd say, this community. Of course, our hospital, they're there 365 days a year, 366 days on a leap year. They're there taking care of patients. And they truly are, you know, a joy to have, to teach, to work with. And this year, 6 out of 7 have stayed in our primary service area, which is phenomenal. And I think that speaks volumes to just the community, the patients, and the needs here, and how they really feel like this is their, you know, professional and personal home, and they wanted to stay in the community. And one other provider who is not in our primary service area is staying in Indiana. So we have 7 out of 7 graduating residents staying in Indiana, and I think that's something really to brag about. Very exciting. So. Any other questions?
The only question I had was, why now? I know this has been a rumor it's been milling around in the community for a while. I don't know who would like to take that, but why now?
Yeah, there certainly is. Why now? Very candidly, there's a lot of changes going on in healthcare. And you may know that because of some of the worker shortages and things like that, there's a lot of pressure on healthcare facilities and such. And we did not have the opportunity until now. So we did not have both the owner of Terre Haute Regional come to the table and all that willingness to say, yeah, I think we could get this done, and that's what happened. And I think it's just due to a lot of the national changes that are happening, the forces that are impacting healthcare.
Yeah. So the owner of Regional currently was okay with kind of giving it up. He saw the benefits in that and thought, if I'm letting it go, it's in good hands. Is that kind of?
Yeah, and we have been really impressed with, so that's HCA. They're the largest for-profit healthcare chain in the United States of America. And they have been very impressive the way they've come and said they want to leave Terre Haute Regional Hospital in a really good shape for this community. And we've been impressed with that. So we've been working with them. They're out of Nashville, Tennessee. And they've been good on that commitment as they've worked with us to help with the transition and such. So they've been very pleased with that.
Can you speak on the non-for-profit, for-profit differences between the two?
Yeah.
And will Regional kind of turn into a non-for-profit as well?
Yes. So they are currently a for-profit organization. About 25% of the hospitals in the country, but 75% are non-for-profit, and they will share that in our mission of being a not-for-profit entity.
Does that mean anything in terms of like patient care, whether you're profit or nonprofit?
I don't think so.
Okay.
No, I think it does
I just
provide.
wondered if the obligations are.
Well, the obligation is everything that comes out stays in this community. Everything. Nothing goes out to any other source. So I think that's the biggest implication. Everything stays in this community. I do want to thank our board of directors on behalf of Union Health. They've been involved in this process, and they're community leaders, and they've helped to be a catalyst to know this is the right thing for the community. And big thanks go out to them.
And again, I know you said you don't really have a definite timeline, but you have like early, mid?
Oh,
late?
yes. Early 2024, our best estimate right now is sometime probably late January to April, somewhere in that.
You good? Everybody good? You good?
Okay,
both
thank
very
you.
much.